Yep. So I'm going to talk about dolutegravir and where we stand. We were 15 minutes ahead. We're supposed to start at 10:15. I think we're almost time now. So DTG, where is it in terms of the global context? If you recall, US FDA actually approved this medication in 2013. So we look at the history of HIV. This is becoming an old drug, but we are still kind of struggling. Many countries, including Malaysia, are still struggling to access this medication. The European Medicines Agency actually approved this in January of 2014. And then the Medicines Patent Pool signed a voluntary license, again, where Malaysia, as an upper middle income country, was not included in the adult license, but it was included in the pediatric license. So let's talk more as we go on about pediatric access too. Although our chair is not very much for pediatric and adolescents, there has been this voluntary license between the innovator VIV and Medicines Patent Pool from April of 2014 onwards. 17 companies have actually signed, have taken sub-licenses from the Medicines Patent Pool, and that's how we are getting this drug worldwide at this point in a lot of low-income countries. In India, generic formulations of dolutegravir actually started becoming available. That's where drugs are originating from in generic formulation. And we started getting this drug from February of 2017. So at least 2.5 years, we have been having this drug as a generic formulation. Again, tenofovir, either in the form, dolutegravir as a fixed dose combination as TLD, or as DTG 50 milligram, is being procured by multiple countries. It is unfortunately led by the Africans again, and many countries, as you would know, starting from Uganda to Botswana, Kenya, Malawi, Nigeria, many of these countries where there's a lot of PEPFAR support are actually using already dolutegravir containing regimen, or TLD, as a preferred first line. So Africans have actually led the way. As one of the presenters cited yesterday, Global Fund and PEPFAR have asked countries to stop procuring nevirapine from February of 2019. And the last procurement of February, if I remember correctly, was for 3 months stock requirement in February 2019. So if you look at procurement for Global Fund now, you would not find anything of nevirapine, except for oral solution and disposable tablets which are for pediatric use. You will not find nevirapine as a procured medication under Global Fund now. I'm sure that's the same for PEPFAR supported if you are countries, if you are buying your medication from PEPFAR funds. One of the things that we always look at, and this is really important, is the quality assurance of the products that are coming as generic formulation. Either DTG as a standalone 50 milligram tablet or as a fixed dose combination with TLD. I did not include here with TAF, but it is already available. TAF, lamivudine and dolutegravir as fixed dose combination is also already available, but it's not in the system of quality assured products. But we have all these products that are under license from VIP and sub-license from the Medicines Patent Pool that have got this quality assurance, including US FDA tentative approvals and WHO pre-qualification. WHO pre-qualification is extremely important in the sense you can get this medication faster, not just about the quality, but also about getting this. So if Malaysia wants, or if any country wants a WHO pre-qualified product to be registered in your country, you can get this within 90 days. So it's up to your national drug regulator and your national program to coordinate and get this drug as early as possible. 90 days is a yes or a no. You get the result. And of course, the marketing will take some more time, but the authorization or the approval in the country will happen within 90 days. So you have all of this list. Philippines, we have colleagues from Philippines have exercised this channel 29 times. Okay? Very recently, Laos, but Thailand, we exercised it to get sofosbuvir, the second sofosbuvir in our country. We use the WHO pre-qualification and the collaborative process of registration. We get that. We got that. Laos have done it. Laos have also done it. Other countries haven't. It's a very simple exercise to get this drug. and it's fairly a confidential process that happens between the WHO PQ team and the National Pharmaceutical Regulatory Authority, or the National Safety. So that option is absolutely available, and you have all of this medication where this quality assured products can be sourced within 90 days. There is also another one which is also called as the Expert Review Panel of the Global Fund, which reviews medications that can be purchased with Global Fund grants. And you have again DTG and TLD, many companies or many products that are already quality assured and and already available in the system. Now, where are we in terms of the regulator? Because the regulator don't approve it, we are not going to get it. So globally, DTG is approved in 35 countries, only 5 in Asia and the Pacific. I'll come to those, which are those 5. TLD has a fixed dose combination again in 34 countries. We have 3 countries that has approved it. Why are we so slow? Why is it that 30 countries, the rest remaining 30 countries are almost in Africa and some in Latin America, very few in Latin America? Why is it that we're so slow? These are the 5 countries which has approved those DTG as either 50 milligram or TLD. So Cambodia, India, Indonesia, Myanmar, and Philippines have got DTG, and the 3 countries have already, as TLD is again Cambodia, India, and Vietnam. So we have very less number of countries who are actually doing a regulatory uptake to the extent that we would require, and to actually allow our people who are accessing our public healthcare system to be able to get this very effective drugs. And where are we in terms of users in the national guideline? Yes, the regulators might have got it into our country, but where are we? I would like to get more feedback from the audience if there have been any changes on this. So Cambodia, Bora is here. They have included dolutegravir as a first line for people who are initiating newly on this. There was women, because of the earlier caution by WHO, there was a remark on women of childbearing age. So I am not aware if there has been changes and updates on this post the July 2018 WHO recommendations. Again, Laos, you won't find Laos in that drug approved list, but they allow some sort of a waiver to get this drug and to be used in the national program. So Laos exercise that. They have support from very technical, strong organizations to implement that system, and Laos has progressed very well. Philippines at the moment is no, but again, they're having an ongoing discussions. Vietnam has it as an alternative first line or a third line, but Vietnam, again, colleagues from Vietnam, I can see Kim is there. So there are very strong transition plan in place that is already happening there. I would love to hear if there has been any changes. In terms of CRO, India is a big country, 1.5 million people on antiretroviral. They are going to switch, they're going to put new people initiating treatment on the dolutegravir regimen. Indonesia is no. Again, Myanmar has done a commendable amount of work in terms of people initiating on TLD, and also they plan to already switch 20% of the people already on antiretroviral to be on TLD containing regimen. Again, Thailand, as Dr. Nitya again cited yesterday, we're in the process. Our guideline was supposed to be released in June, but it has further been a bit. Now, this was one of the things that we talked about. So price would be one of the factors that we're going to look at. So TLE with 400 efavirenz is approximately costing around $72 per person per year. This is under Global Fund pool procurement. It's an export price, so there might be a little bit up and down with taxes included. But Global Fund, your grant agreements with your countries says that the countries are not supposed to charge any tax on health products procured under Global Fund from January of 2015 onwards. So the country's tax should not be added on to this. There might be other which are on the contract of procurement. TLD is around $70. This is per person per year. DTG alone, if you're going to do TL and a separate DTG is going to be around $42 per person per year. And then TL, as we talk about, if we want to give it separately, it's around $42.6. So if you combine If you take tenofovir lamivudine and then dolutegravir separately, then it would be a little bit higher, and the pill burden is a bit more higher to the end user, to the patient. But then that option is also available. Let me end here, and then I'll be happy to take questions as we take on about Malaysia and other things and other access opportunities as to what we can do. Thank you.